Well, hopefully people are holding on. I know it's always hard after lunch. A couple things. I want to thank Mr. Gilfillan for reminding me why twice I've said no to Washington. I have no patience. And I was lucky enough to do some work with Mark McClellan as the Chief Medical Officer and Chief Innovation Officer of CVS Caremark during Part D, and actually had an apartment in Washington, but never stayed long enough that I got overly frustrated. So he reminds me why that is. One of the questions that was up there earlier about are they patients or consumers? I am going to make an apology to start. I am going to call them patients, people, employees, members, and consumers. So I am really confused. But one of the things I would say, I've done a lot of work. I've written 4 books, a lot of work on engagement and communications. And as I've talked to people, the one thing that I've heard is, although we don't like to officially be called consumers because of the connotations it has with that, people don't like to be called patients either because of the connotations. So I'm not sure what we are today, and I think we are in transition just like the healthcare system is in transition, and that's a little bit about what I'm going to talk about here, is this next piece of the puzzle, which is the us. Because whether we are employers, whether we are providers, whether we are governmental workers, at the end of the day, each of us interplays with the healthcare system, officially or unofficially, as patients or consumers at some time. We would all agree on that. Engagement is hard. I'd like to believe that there is a pill we could take. I did come from Caremark, so it's all about the pill, right? But something we could take that would make it easy. But it's not. And I want to start out with a personal story. So how many in this room are 50 years old or older? Can I see it? So congratulations. We've all gone to the doctor for that 50th birthday visit. We know what that entails, right? Congratulations, great to see you. Here's the list of tests you have to have. So, you know, we know for a woman, it's mammography, we need to get additional shots, and that ever-present colonoscopy. All right, so I left my doctor, who I've seen for many, many years, with my list of things. I come back a year later, and Corey says to me, Jan, I see here you haven't had their tests. You're in healthcare, you know better. And I said, yes, I'm getting to it. Well, this proceeded for 3 more years. And each time I walk in, she'd get louder, like I couldn't have heard her last time, and maybe that's why I didn't do it, right? So finally, at 54, she says to me, and I apologize for my language, but this is true. She said, damn it, Jan, you're ruining my incentive bonus. Go get the tests. So my inner child, which when I'm told to do something and not told why, or engaging me, looked at her and said, I'm really glad it's all about you. Do you want to now ask me why I haven't gotten the tests? I said, you know what I do for a living. I am on the road Monday through Friday. When was the last time you saw a company that did mammography on Saturdays, did colonoscopy on Saturdays, that did bone density on Saturdays? And she said, oh, never thought about it. The biggest issue was not that she couldn't help me and we had to look together, but she never asked me what my barrier was and what my issue was. So 3 lessons that come out of this. Number 1, even those of us who are involved in healthcare, or myself, I've spent the last 25 years of my life really focusing, whether it was as a physician or as an executive, on the area of engagement. I understand many of the problems. I'm still not as engaged as I need to be. Number 2 is it needs to be simple. If we're asking people to do things, it's got to be made simple for us, and it's got to be relevant. It can't be about the employer. It can't be about the provider. It can't be about the health plan. Somehow we have to make it about me, because otherwise I don't care. And then number 3 is multiple stakeholders have to be engaged. I look silly going to a dance and dancing alone. You know, I'm showing my age. Those disco days when there was that one person who was standing at the mirror dancing with themselves. It doesn't work really well. It's not pretty. It's not effective. So I would argue all of us, all the stakeholders have to be engaged. And I'm going to talk a bit about how employers today and a bit about how providers today have to be as engaged as the patient, consumer, person, whatever we want to call it. So let's go for it. We're going to set the stage. These beginning points you've heard today multiple ways. I'm going to reiterate it just in case, because I'm also on the marketing side of the world. We all know, anybody here who's in marketing knows you have to say things at least 7 times in order for any of us to pay attention, because the world is so noisy. So some of these things you're going to hear again. Healthcare is 18% of the GDP. It's growing annually. We all would probably agree, although there are a few people who say, look at what we're getting for that 18%, we're doing great things. I would argue we're probably not getting all we could out of that 18%. I look at countries, I've gotten to work and consult in 11 countries, so I am going to use some examples from other places. I look at Chile. Their quality outcomes and their life expectancy is higher than ours, and they're at 6% GDP. I'm going to tell you why in a few minutes. But there are 3 reasons, again. You'll always hear me give 3 reasons. Somewhere I was trained 3 is the right number. You can't have less bullet points than 3, because then it shouldn't be bullet points, and you can't have more, because then we don't remember. So we have an aging population. We know that. And the interesting thing about an aging population is things that used to kill us don't kill us anymore. Cool, right? But one of the problems is, as we age, we use more healthcare assets. So it's a good news, bad news sort of thing. Cancer used to be a killer. Thank God today, in many cases, it's a chronic disease. HIV used to kill us. It's a chronic disease. So the good news is we are aging. By the way, if you get over the age of 93, you actually use less healthcare resources. I guess it's, Darwinian that if you've made it that long, you're relatively strong and healthy. So just think once we get over 93, we're in good shape. Number 2 is the cost of diagnostics and therapeutics. So, it's great to hear this morning that hepatitis C was brought up, because every conference that I've been at or spoken at or attended since November, every single one has talked about hepatitis C, because it's a great poster child for some of our challenges today. But these are things, they're not going to get cheaper. They're going to get more expensive. We were all excited because generics came in and lowered the price. We have really exciting new therapies coming about, but they cost. I come from a cystic fibrosis family. I had siblings who died at 3 years old and at 5 years old. They didn't get to age. Today, they live to 40 and 50 years old. But there is a cost, a hardcore financial cost to that. So that's the second reason our costs are going up. And then the third, always there, chronic illness. So we know, and again, I'm preaching to the choir. In 1995, we had 118 million people with chronic conditions. We have raised that by 50% in 20 years. Again, some of the good news is people who died before now have chronic conditions, right? That's a good thing. The bad thing is, another reason is because of 75% of the chronic conditions are due to our own activity or non-activity. In fact, there are 8 risk factors that have significant impact on 15 chronic conditions. So I talked about my engagement struggles. How many of us know that you need a good night's sleep? How many of us get 8 hours a night of sleep? A couple of you. How many of you all know that activity and exercise is good? How many of us got up this morning and exercised? All right? Oh, we got a few people. I'm impressed. So some of this is our own issue. If we were having this conversation in the chamber, we're in Louisiana or Mississippi, the other piece we would be talking about is that 30% of the children in those two states are obese and have either pre-diabetes or type 2 diabetes already. So those of you who are employers and looking at the profile of your employees and seeing people who are 50 and 60 years old with the comorbidities associated with diabetes, you are going to see in this next generation of children that are growing up now that those comorbidities of heart disease and kidney disease and blindness, we're going to see those in the 20-somethings. Because at 10 years old, they've already got type 2 diabetes. It's scary. So what do we know? Our system's unsustainable. Some of it is due to the good work we've done, but a lot of it is due to places where we can make a difference, but the only way we can make a difference is to be engaged. So we spend about 5,000 hours a year with our families, unless it's somebody like me who travels 200 days a year, and then it's less. We spend over 2,000 hours a year with, in our employment environment. And we spend about an hour a year in the healthcare system. So the healthcare system itself is probably not going to be the biggest impact of how we engage in our own health. It's probably going to be our workplace and our families and friends. And so that's some of what we have to look at. That being said, in the workplace, as you heard, I've run a consulting company for about 7 years. Prior to that, I was Chief Innovation Officer, Chief Engagement Officer, and Chief Medical Officer for CVS Caremark. One of my clients is Midwest Business Group on Health. So I want to share with you some information and some work we did 2013 and 2014 as the backdrop for what employers are thinking. And those of you in the room who are employers will probably shake your head, yes, none of this is rocket science. So we turned to our members in 2013 and we said, what are the things that are keeping you up at night? Where is your foci? These are HR people for the companies that are members. And 56% said creating a culture of health. And I said, cool, that's really neat. What's a culture of health? All right? So there could be lots of definitions of this. Tell me what you think it is. And as the group worked on it, they came up with 3 things. One is integrating the company mission and culture with health improvement. The second is aligning that health improvement with the corporate business strategies and goals. Because if they weren't integrated in one way or another, one was going to win out over the other. And then the third was to provide a safe environment to encourage health improvement. And we're going to come back to that third in a little bit. I then asked them, because we have to keep getting rid of that inner child, I said, why? Because if I don't understand why that's their goal, then I may miss something in working with them. And you know, the 800-pound gorilla in the room, really obvious, 90% said healthcare costs. Probably not surprising to any of you. Number 2 was productivity. And number 3 was gaining and retaining high-quality employees, even at a time where the job market was still stagnant. Finding those right employees to help on productivity and to help on being a multinational company and fighting for our place in the world was still very important to them. 45% of the group said better focused wellness programs. So I said, great, what kind of wellness programs are you doing today? So we heard tobacco cessation. We heard healthy nutrition. We're no longer talking about diet alone. We're talking about healthy nutrition and exercise and stress, the common ones. And I said, well, it sounds like you've got a lot of the right programs. Why do you say more focused? And many of them said, because we're not getting the ROI we wanted out of our programs. You're going to hear Dee Eddington come up in a few minutes, and Dee and I have known each other for many, many years and have had this conversation. Is ROI the right measurement for these employers? And I asked them that. I said, so if you lose 10 pounds, sleep better, starting to be more active and think about exercise in one way or another, are you really going to see a decrease? Do you really expect to see a decrease in cost in 1 to 3 years? I said, is that realistic? And after we went on, there was a lot of, oh my, I guess I'm measuring the wrong thing. And so my focus is 45% who wanted more focused wellness programs because they wanted a better short-term ROI. I think many of them started to rethink, why did they want more focus? And I would ask you all the same question. If you're looking, first of all, you have to measure something in wellness. And we're still trying to figure out what those metrics are. But we have to measure something. I would argue you should do no activity unless you're measuring something and are hoping for some level of impact. Better energy, maybe better productivity, definitely more health engagement, maybe a slowing down of the conveyor belt of chronic care, of chronic illness. Those, I would argue, should be our wellness measures, because most of us don't go to work at places like Trek. By the way, I want to go to work at Trek. All right? I am in the wrong business. So that's, those were two of the things. The most consistent, most commonly answered question of that question of what keeps you up at night, at 93%, first place, was employee engagement. Again, hard to measure, hard to get. So asking the what do you mean by that? Well, it's employees focusing on their own health and becoming good consumers and understanding benefit literacy. And I thought this was great. You can't use your health benefits, health or health care, either one, benefits in the right way if you don't understand what they are and how they affect me. Remember the relevance issue. Have any of you ever sat down and really read your health benefits before you really needed them? I tried. It works better than any of those sleep aids out there. And if I don't understand them, and I've been in the business for 35 years, how are we expecting our employees to understand them? And by the way, they're the ones who have to go home and tell their family members what they say as well. So it was a very interesting issue. They also said in the engagement that they have been offering great programs since the early 2000s, whether it's disease management, whether it's wellness, all kinds of programs. And nobody is going into the programs. We're excited if 20% of our employees enroll in one of these programs. How many of us feel like we have more time to add another thing that we're going to say yes to? None of us. It was interesting. I ran a disease management company for a while when I was at Caremark. And all we did to go from 20% to 62% enrollment was change a couple words. We're going to activate a program that you're already part of instead of would you like to enroll. It's the only thing we had to do. And by the way, it costs you nothing, and it will take very, very little of their time, and it's about you and your family. because there are many ethnicities we're working with. It can't be about me. It has to be about my family. So by changing those few words, we totally turned around our engagement rates. And we kept sustained engagement rates by inviting the families to be, as a family constellation or friends, to be part of a program. No one likes to do this stuff alone. When I work out at home, I work out because there's a person who I meet 3 mornings a week at the pool to swim. On those mornings that I hate getting up, you know why I get up? Because that other person's there. And they're going to make me look bad. And by the way, when you ask her why she gets up, she says that other person's going to be there. So neither of us, we're not allowed to call each other and say, are you going? It's an unwritten rule. Life is a team event, and we have to remember that as well. So we then turned around and we said, I asked the group at Midwest Business Group on Health, what do your employees think about these programs? Have you ever asked them? And they were like, no, we actually haven't. We assume they love it. You know, a comment was made by a colleague over there, nothing about me without me. We need to ask what people think. So interestingly, we did a survey of a number of the employer group's employees and asked them what they thought of some of the health and wellness programs we had. So in this case, it wasn't 3. We got 4 answers. Number 1, the employees are terribly skeptical. Is it another flavor of the month? What are they going to do, they, the employers, with my information? Am I not going to get a raise if I don't engage? So terribly skeptical. Number 2, they felt the programs were disingenuous. They didn't see senior management totally bought in. Even something as simple, and this woman in the qualitative, not quantitative section said, I've never seen our executive team or our CEO as the first ones in the chair when we're doing a blood drive. It's a pretty simple thing to do, isn't it? So they found it disingenuous. Time was number 3. I'm already stretched for time. Now they're asking me to take my personal time and work out. They're asking me to cook healthier meals. Do you know how much longer that takes? So time, they resented the time issue. And 4th was cost. And that was that out-of-pocket things are costing more. Healthy food costs more. Going to the gym, when they heard of being more active, they automatically thought about going to the gym. They didn't think about other things you could do that maybe weren't costly to around health and wellness. So those were the 4 things. But each and every one of them said their health was important to them. So it's interesting, they're not throwing off the issue of health not being important. But they had these other things, some of which they can make a difference on, and some of which those of us who were offering them what we thought were great programs and attributes, they resented and didn't understand. So around this, we have another issue, and that's today's healthcare environment. We've heard the triple aim a number of times with access, quality, and cost effectiveness. I would argue we will never hit the triple aim unless all stakeholders are engaged in this striving for health. Again, it can't be one single dancer, and we can't be pointing fingers, because we really are all responsible and have a little piece of this. But the other issue is the new incentives to be engaged. And again, you've heard a few things like this. Health plans. Is anybody in this room come from, at some point in their career, on the health plan side, a quality department, director of quality? All right, I see a woman over there. So your office probably at one point in time, like mine, when I started my administrative career as head of quality was in the basement next to the boiler room, and now somehow we've made it to the boardroom because our metrics directly can relate to revenue production through things like star measures in Medicare Advantage, or where we're listed on an exchange in the exchange populations. So it was really, we were an also ran, and now we've got all the attention on us, which may be a good thing and may be a bad thing. But it has made engagement much more important for the health plans because they are measured, graded, and paid on it. Providers. When I trained, I am a pediatrician by training. When I trained, my relationship with my patients was what gave me my happiness. I am a pediatrician. I'm not a surgeon, so cutting it out didn't work. It was about the relationship and engagement. But I wasn't paid if my patients went and got their shots or weren't readmitted. We now have new payment and new organization models where, as we heard my doc, Corey, say, damn, Jan, you're hurting my incentives. They now care. It's not just, I need you to do this because it's the right thing. They've got money and skin in the game, too. Patients need to be engaged for a whole host of reasons. First and foremost is quality of life and feeling good and having the energy and desire to do the things you want to do. But we've got much more skin in the game money-wise. The era of medications costing $3 or $5, because that's what the copay was, so that's what we thought it cost us, is gone as we look at high deductibles. I'm in a $6,000 high deductible plan. I think very differently. I do ask my doctor, so to go get this test, which hospital do I go to? The problem is they don't know the costs either, and we'll come back to that. But patients have a reason to be engaged as well. So we've got an engagement problem. Everybody's got skin in the game and trying to figure this out, and that's why you will read more about engagement in the next 6 weeks or last 6 weeks than you did for 10 years. Everybody's talking about engagement. That's the background to it. We all got to figure it out. So I would argue there's 4 levels of engagement. And unfortunately, how we measure it today is in many ways by medical claims. Not a good way to define engagement, if you ask me. But that's how we often do it. So the first level of engagement is unengaged. Now, whether people are unengaged by medical claims or not is an interesting issue. Because if I'm healthy and active, and maybe I'm seeing an alternative, complementary, outside of my benefit system person, and I am still engaged. But I'm not doing the things that show up on the normal metrics that are being done. So you have to be careful when you call somebody unengaged, but you have the unengaged. You then have the casually engaged. The people who really aren't using the system, aren't necessarily thinking about their health on a regular basis, but go and, oops, I broke my leg. And I have to have this taken care of for a period of time, and then I go back to whatever my baseline was. But there was just a small glitch in what I'm doing. The third level is what I would call intermittently engaged. How many of you all went and got flu shots this last year? A lot of us, especially with the fear of that it was going to be a bad flu season. If that's what you do, that's great. But if you do nothing else during the year for your health, within the health system or not, you are considered intermittently engaged. You drop in and you drop out. And then there is sustained engagement, or when engagement becomes a habit. And that's what we want to do, is engagement as a habit. I, for the last 3.5 years, have worn a pedometer on my wrist. I have tried all of them. I'm an equal opportunity trier. When I forget to put it on, I feel naked. It has become a habit. The other issue is, just so you know, my mother and I both wear one. And every single day, no matter where I'm in the world consulting, we call each other and see who has done more steps, all right? So it is a competition. You know, it really is a bad thing when your 80-year-old mother, about 50% of the time, has more steps than I do. But it has become a habit. I don't have to think about it. It's not a decision I make. It's just part of who and what I am. That's where we want to be with engagement, and none of us, including myself, is at that in all the places we want to be. I just happen to have one of those places. So why aren't we engaged? We're overwhelmed, we're overcommitted, we're confused, we're stressed out, and I would argue we have lack of trust in the system. We don't trust our employers, we don't trust our doctors, we don't trust our healthcare systems, and we don't tend to do things if we don't trust the infrastructure around us. So what we have to do, and I've done a lot of work recently on this, is on the issue of trust. So I told you I was going to use an example. So all around the world where I go, I ask the question around adherence. Adherence to medication, adherence to guidelines, things of that. You know, diabetes testing, those sort of things. There is only one country I have found that does not have an adherence problem whatsoever. Anyone want to guess what that country is? Japan. Nope. Nope. You ready for this? Cuba. Now everyone's going, Cuba? I've been lucky enough to be there twice, last January and this January. The reason they don't have a problem is because the relationship they have with the primary care triad that cares for them. They have it's called the consultorio, and it is a physician, a nurse, and a social worker. And every 6 blocks, every 100 families is a member of this triad. And how they do this is amazing because half the day is in the office and people can come in. There are no appointments. You come in when you need to. Half the day is going into the home and understanding the psychosocial issues of the home. And because of that trust, we talked to a gentleman. They also have almost no privacy. You go in, we were talking to this doctor, the triad, and she said, let me have you talk to some of my patients. So she's bringing patients in the room. And we're talking, and we ask these questions, and they're all like, no, we trust our doctor. She's part of our community. She lives in our neighborhood. We go to church with her. We do all these things. We trust her. She wouldn't tell us to do something unless it was important. We don't understand how important trust is. So what have employers done and health plans done? It's great, and I've heard a number of our speakers today talk about technology as a way to scale in a cost-effective way, making people engaged. I would also ask you all, for those of you who have smartphones, how many apps have you put on your smartphones that you still use from the day you put it on? If you're anything like me, you put it on, a third of them I never use. A third of them I use I've used 3 times and gotten rid of it. And probably at the end of the day, 10% I use on a regular basis. And by the way, I have a really messy smartphone. I still have probably over 100 apps on there, most of which I never use. So let's understand throwing tools at people is not the ultimate engagement answer. In some cases, for some of us, one will work. In some cases, for some of us, others will work. But don't think it's the end game, because it's not. There's a new self-diagnosis set of tools. How many of you all have children? A lot of you? So most of you all have gone through the ear infection stage, right? So there's a new app out called Cellscope. And what it is, it's an app, it's an earpiece, and it hooks into your phone. And what you do is you put the earpiece in your child's ear if you think they have an ear infection. It videos, it sends it over the smartphone to a Cellscope physician, and they diagnose for you. So basically, you're self-diagnosing with the help of somebody else. Nice theory at 3 in the morning, maybe, but that's not necessarily how I want to get my care. Self-referral tools. There's a new tool out there called Any Test Now. By the way, if I've offended anybody, I apologize. This is really just to give examples, so I apologize up front. So this self-referral tool, Any Test Now, 150 locations nationally. It's a direct-to-consumer laboratory where you get to decide what tests you want and need, and you go in, and then they go after, listen to me. You can get my bias here. Your health plan, and ask them to pay. You haven't had a conversation with a doctor. It's written by a nurse practitioner who's in the office who just writes the order when you tell them what you want. I'm not sure that's the most cost-effective, engaging way. Yes, you're thinking about your health, but I think that there are issues here. On the other hand, there are a number of health plans. I don't know if any of my health plan colleagues in the room here are doing this. There are a number of health plans who say for women on an annual basis who need to go get a mammogram, you don't have to go to your provider first. You can schedule your mammography. I actually think that self-referral model is a good model, just as long as the mammography center is sending your doctor your results along with yourself. So there are some places where it makes a lot of sense. Transparency tools. Total transparency on my comments. I have helped 3 business groups on health choose a transparency tool vendor. I have also consulted for 2 transparency tool vendors. It's an area I really believe in. In 2002, my team at Caremark developed what we believed to be, at that time, the first pharmacy-based transparency tool. It was before Consumer Reports and others had done it, and I thought it was a great idea. Unfortunately, many of them aren't easily understood. They don't integrate quality. I think it's a great starting place, though. But my roommate, who also has a $6,000 high deductible, is on a high-cost eye drop for a chronic disease. By the way, with my family, I will not go to jail on privacy. They've all signed over HIPAA waivers. So you guys will not visit me, and I will not be on this next season, Orange is the New Black. So just to let you know. So she went up onto her tool, and she was more confused afterwards than she was before. And her comment after using it that first time is, I'll never use this again. Because if we try something once, and it makes us feel foolish, takes more time, confuses us, guess what? You're done. It's going to take you a long time till you go back. So as much as transparency tools are really a good idea, they're still a work in progress. They're not the answer. So we have to be careful. And I want to also remind you, both in the trust issue and in the transparency tool, I want you all to go and look up, and we're going to use my favorite topic, colonoscopies, and see what the cost is of a colonoscopy. Well, it's confusing because it's not one price, is it? If you're not getting it through preventative care, you have the doctor, you have the pathologist, you have the center you got it at, you have anesthesia. It's not easily packaged in one place. So again, you're not going to use it. And by the way, as we as employers say to our employees, or providers say, colonoscopy is now free due to the Affordable Care Act. It's only free if they find nothing. So good, I'm going to go and get a colonoscopy, or I'm going to get a mammography thinking it's free, and I come out with a bill because maybe they found something. So shame on you for going and getting this in the first place, because now it costs you. We're a little backwards in this, aren't we? So again, we're not going to trust the system that told us it was free. That is a barrier to engagement. Plan design. And we're going to go through this quickly. We've talked about high deductibles. I believe in them, but you have to understand the implications to them. When I have a $6,000 deductible, I may not always do those things that are in long-term best interest for me. we still aren't explaining and working with people to look at those high-value things. We also know that the government and the IRS has not been clear about what those things are that are preventative care that can be zero copay and not part of the deductible. It's very messy. I think that Dr. Mark Fendrick out of University of Michigan, who I've done a lot of work with, Mark, and he spends a lot of time looking at not only value-based benefit, but what are the high-value things. And it's important we think about that. What if we were to say to people, you don't have to take a day off for your colonoscopy. We're going to give you that day off. That's an add-on. You do what we think is important to you and to us. We're going to give you that day. And by the way, whether or not they find something abnormal, if it is a screening, colonoscopy, mammography, we're going to pay for it because it's a high value. People are going to be more likely to do it. A barrier to engagement. And I'm not saying cost is the only barrier to engagement. There are lots of barriers. But we have to think about that in plan design. Incentives. We're all using incentives for people. And we have an interesting problem because behavioral science says disincentives are more effective than incentives because loss aversion is more effective and more potent than giving somebody something. Because then you can say, I didn't have it in the first place, I don't really need it. Versus, I had this and I lost it. And none of us like to lose things. But the problem with disincentives that we have to kind of think about is that remember when I started out saying a culture where it's safe to do health and wellness? That tends to decrease that safe environment issue. So I would think you can still use it. I would suggest some marketing and communications issues around that. So I'm going to end in this last space, and that is some tips for employers. And there are not 3, there are 6. So 3 times 2. Number 1, senior leadership buy-in. If you want to engage your members and you're going to use healthcare, wellness, I don't care which of these activities are, so I tend to say health and healthcare, you have to have buy-in. And you have to have a real cultural shift. What about not allowing the first meetings in the morning till 9 o'clock so those people who want to work out in the morning can work out in the morning and not get up at 4 a.m. so they still also get their 8 hours of sleep so they're productive? What about having a half hour, 45 minutes during lunch where you, again, have no meetings scheduled so people can either have a healthy lunch, can go out and walk or exercise, and maybe have the last official meeting end at 5 or 5:30, again, so people can go home and cook food for their family. There is a company in the Chicago area that has done this, and their risk scores for long-time chronic conditions plummeted. And when I asked the CEO, has it negatively affected productivity? And interestingly, it's a female CEO. You could argue maybe that's part of it. There's been some studies around this. But she said no. In the end, we were really worried about it. The executive team had a lot of fights and arguments about it, that we won't get everything in. And actually, their productivity has remained the same, and their long-term health risk scores have plummeted. Number 2 is comprehensive strategies, not conflictive. Most employers do not use the power that you all have. And there's 2 places where I would argue this. Number 1, how many of you all do a vendor summit of all your health and welfare vendors once or twice a year? I love it. Love you. Love you. It is one of the most effective things you do. So a number of years ago, I was one of the vendors, a very large, one of the top 15 mega employers in the country, locked us all in the room, almost quite literally. and said, here's the deal. Number one, you don't get to go out and go to the bathroom unless you raise your hand first. But more importantly, everybody in this room who is a vendor, for this moment, you work for me. And we are going to choose 2 or 3 things that we're all going to work on together. We see this in medication adherence. So if your disease management vendor, your health vendor, and your PBM vendor, your health plan vendor are all giving different messages, guess what I do? I shut down. I'm not listening to any of you. And if it's conflictive, I shut down and don't trust any of you. And we get back to that trust issue. We had a large national organization that prior to ACA wanted people to get their preventative care before it was free, right? They gave everybody $100 in a little fund. How many of your preventive care tests can you get with $100? Not many. In many cases, not even one. So what they thought their plan design was in conflict with what their strategy was. Communication. It's not a vendor one and done. It's not I get to talk to and communicate to my employees once a year over open enrollment and I'm finished. It is an ongoing communication conversation. And by the way, conversation means it's 2-way. Asking your employees what you think. We're all terrified to ask. But actually, you can get some really interesting feedback. You know what the #1 engagement tool is? And this is number 4 in your strategy suggestions. The water fountain. Because that's where people share their successes and their frustrations. And I talked about wellness and health and engagement being a team event. A large bank in Chicago started to have adherence lunch and learns. And they would get groups together to talk about how hard it is to take all their medications or to get all these things done or to stay on track. And it became that they had 3 lunchrooms going at once because people wanted to do this with other people. And we learn better from each other. And in fact, there's an article in Annals of Internal Medicine that showed an employer and a health plan that came together and looked at peer counseling versus care management counseling. And the peer counseling got a 2x better outcome in hemoglobin A1C, long-term blood sugar in diabetics, than the care management did. Peers make a difference. Establish metrics. I said earlier, figure out what you want to measure. Find those right metrics. Talk to each other and see what metrics have worked. Again, just like employees need people to shoot ideas off of, employers need ideas to shoot things off of. And health plans in the room, you get to work with lots of employers. So if you have seen a best-in-class thing that works, share that with all the employer groups that you're working with so that we can all succeed. And last, but as important as all the others, is be patient and be realistic. Like the wellness programs, if you think that an ROI is the only way you can measure success, I think you're going to be disappointed. That being said, I want each of us, because I always give people assignments, I want you all to find one little thing that you can talk to a friend or a family member around one little change in engagement in your own health. It can be something as easy as sleeping 10 minutes longer, or once a week doing X. You figure it out. But with that, thank you very much.